Hello and welcome to Mo Talks. I'm Dylan,
I'm Jamil.
and we are here today with two trainee clinical psychologists. Um, we have Rubia and Odile, which is really special because we haven't had psychologists or trainee clinical psychologists on our show before. So we really both are quite excited to have them present themselves and hopefully answer some questions which we have prepared. Um, Rubia, I'll first introduce you as a first year trainee clinical psychologist at the IOPPN. Rubia's current research interests include examining mental health inequalities experienced by young refugees and asylum seekers. So thank you, Rubia.
Thank you so
Thank you
much
for
for
joining us.
Oh no, thank you so much for having me. I look forward to it.
Yeah. And then we have Odile. Odile is a first year trainee clinical psychologist at the IOPPN. Her current research interests include examining substance use in young people, and Odile is um, also currently in a placement in the Leo team, as well as Rubia. So they're both on the Leo team, which is really quite a unique situation because the Leo team have actually helped me so much personally. I'm not sure how much I can say about that, but yeah, I've really found their research to be quite helpful for me doing better.
Thank you for
Um,
having me.
yeah, of course. Thank you for coming. Um, so we'll start off the podcast with a few questions. I think that's how we'll frame it, and then from there we'll have hopefully some of the questions answered, and then we'll have a bit of a conclusion. And yeah, Jamil can also, we'll both be co-hosting today. Yeah, okay. So question number one, and I'm not sure how we'll answer it, but let's just get to it. Um, what inspired you to pursue a career in psychology? Maybe, I'm not sure who wants to start.
Adele, do you want to start or do you want me to?
You're speaking. You can start if you want.
Mhm.
Um, so in terms of clinical psychology, there's various different reasons. I think for me personally, I am a care leaver, so I grew up in foster care, and I experienced different sort of I guess difficulties, childhood difficulties, and for me, then coming into adulthood and learning more about how that's impacted me, like mentally, emotionally, psychologically, was really, really helpful. And I guess I wanted to then provide that space for others who may be experiencing different sort of vulnerabilities, or different sorts of trauma, or different sorts of struggles, different sorts of difficulties. I wanted to be able to provide them with that sort of safe space that I found that the field gave to me. Um, and then just also very passionate about working with sort of communities, and different sort of groups of people who have often been quite marginalized in society, and sort of seeing, okay, how can we support to improve their health and their health outcomes, and sort of yeah, work together in that way. I just genuinely love like speaking to people, being around people, learning about people. So yeah, I hope that was like a brief summary as to why.
Yeah, that sounds great. Thank you, Rubia.
Yeah, I
And
think,
Odile.
yeah, I mean, I'm sure there are kind of similarities in terms of helping people, wanting to do that. I guess for me, obviously different experiences in my personal life. I think, yeah, there are kind of different experiences as well, seeing different people around me struggling, and I guess growing up having that desire maybe to help them, and then wanting to have a career where I could help others, and I suppose give back, to my community in terms of, yeah, helping them feel better in themselves. I think that's kind of what drew me to psychology, and the study of it. I think what kept me in the field was noticing kind of the power of just being listened to, and having someone be there, for you, kind of seeing that with other people struggling, and just even simple things of I'm here to listen, what happened to you wasn't okay, or I believe you, just simple things like that, and the power that they held, I think really kept me to the field. And then clinical psychology specifically, I think it's a role that gives a lot of flexibility around the kind of people we can work with, where the training isn't specialized in one, population, one client group. So we can work with lots of different people who experience a lot of different difficulties, and also learning lots of different ways of working. So I think, yeah, that's what kept me in the field, and clinical psychology specifically.
Wow, sounds very interesting. Thank you. Thank you for sharing.
You're welcome.
What areas of mental health are you currently focusing on in research or professional practice?
Yeah, I
So,
think, I mean,
do you
sorry.
trying to
Some
figure
of it
out
was
yes.
introduced at the beginning. I think, I guess in terms of research, as was mentioned, I'm focusing on the substance misuse, kind of substance misuse in adolescents and young people. I mean, I've done other things in research, but that's what I'm looking at right now. I think it's really important to think about prevention, and helping people who are struggling as early as possible. And then at the moment, again, as was mentioned, we're both working in the LEO team. So that's the Lambeth Early Onset team. So that's working with people who've experienced, first episodes of psychosis, which has been really interesting as well. And I've really enjoyed it so far.
Yeah,
And Rubia?
sorry.
Sorry.
Following on from Adil, so yeah, my area of research at the moment, I'm looking at um, how young asylum seekers and refugees find sort of like health services, specifically mental health services. So looking at the data and just sort of exploring how to improve their experience of mental health services. I guess it's an important area of research for me, going back to sort of looking at different communities who face different struggles when it comes to accessing support. That could be language barriers, that could be stigma, that could just be fears around systems and coming into contact with, new people, new systems. So sort of figuring out how we can sort of build that bridge and improve their experience of services. And also just recognizing that different communities and different people have different needs. So how can we sort of like support our services to be more mindful of that, and more inclusive? So that's sort of my area of research at the moment. And then yeah, also at the Leo team, and sort of looking more into first episode psychosis, and that's been yeah, I really loved working at the Leo team and being there. So yeah, I hope that sort of summarizes it.
Yeah, that was an excellent answer. Thank you. So another question we have for you both, maybe Rubia, you can answer this one first, or actually up to you, but I'm just going to suggest it so that there's no confusion. Do you have any advice for people with psychosis, and how they could maybe keep well whilst having whilst having psychosis, or yeah, how to just keep well with it?
Yeah, so I think people generally, just like a disclaimer that your experience of psychosis is going to be completely unique to the person, and then the support that follows. What works for some people might not work for other people, and vice versa, and it's sort of trying out different things. Um, But just generally, I guess a really important thing is looking after sort of your physical health. I think physical and mental health really intertwine and they really link. So I guess different ways of looking after physical health, and it's not always easy, it can be really difficult. But for instance, it's sort of like trying to get like enough sleep. We know sleep impacts how we process our emotions. It can make us feel lower in mood. It can sort of heighten be feeling anxious. So sort of trying to get into a pattern of good sleep, which again is not always easy, but maybe figuring out doing some sleep hygiene or setting aside time to wind down before going to sleep. Also thinking about sort of food, what we're eating, eating regularly, keeping your blood sugar stable. That can also make a huge difference to sort of like your mood and energy. Physical activity as well, like exercise can be really helpful for well-being, mental well-being, sort of for processing. Some people find it quite difficult to sort of verbalize what they're feeling, to talk about what they're feeling. And at times, sort of exercise can be a really good release, just like a stress release in of itself. Really helpful for those who find it maybe a bit more difficult to verbalize it, or even just in addition to speaking about it. Doing physical activity can really help as a source of like stress release. Um, Spending time outside. So when we think about physical health, thinking about your physical environment, that might not always be easy for some people. The home might be a difficult place. There might be different reasons impacting that. So trying to get out as much as you can, maybe in greenery or to your local park, just different areas outside, there can be a huge impact as well on your well-being. And then sort of trying to avoid like substances whilst you can, sort of drugs and alcohol, because of course like drugs and alcohol can help cope with really difficult feelings in the long run. Sometimes they might have sort of compounded health effects, so just being mindful of that as well. But again, it's a journey and it looks different for everyone. um, and in terms of others, it's sort of maybe creating something we call like a crisis plan. So during a crisis, you might not like be able to tell, might not be able to know who to go to, etc. initially. So like beforehand, sort of planning around for that. Obviously, it's not something that people like want to think about. But it could be really helpful. So when you start to feel like, okay, things are getting really difficult at the moment, who can I contact? Where can I get the support? Maybe that's family members, friends, services that you're in contact with, local communities. For different people that will look different. Could be a faith community, could be a culture community, could be a community based on lots of different things, but sort of knowing that you have that and knowing you have that support and thinking about ways to sort of support yourself ahead of maybe those feelings becoming more intense might be really helpful. So yeah, this is my tips around just sort of like physical health, maintaining that, and then also planning ahead um, the support that would be really beneficial if needed.
Yeah, got you. Thank you.
I guess I mean, adding on to what Rubia said, again, yeah, everyone's different, but again, some common things can be, maybe Rubia mentioned community and how important that is. I think seeking peer support can be really helpful as well. I think psychosis, unfortunately, has still a lot of stigma attached to it, and there can be a lot of myths around it. So meeting other people who have experienced similar things and speaking to them can be really helpful. Accessing kind of services where you are able to do that. Maybe the Mosaic Clubhouse can be helpful to meet other
Yeah.
people and myth bust. I think can be really powerful. I suppose that accessing other specialist support or speaking to your family to recognize triggers or early signs that maybe you're becoming unwell can also be really helpful to try and intervene early. And then I guess stress impacts everyone. But I think with psychosis, stress can be a big trigger in itself. So learning how to manage stress, learning maybe relaxation techniques, breathing, grounding, kind of staying in the present when our thoughts maybe get away from us. Those can also all be really important things to do. And those are all things that you can kind of find out more and practice doing yourself. There are lots of websites. The Like Minds website or the Mind website have lots of great tips and info, but also, yeah, again, I guess we're maybe a bit biased being trainee clinical psychologists, but accessing help from others, it can be really scary and feel really difficult, but also I guess we feel and hope that it can also be really helpful to people to get that support and that advice as well, and having someone to go on the journey with you.
Okay. Sounds good. Thank you for the tips.
Welcome.
What's your keep well tip?
Keep well tip kind of echoes what Adil's mentioned, what I've mentioned towards the end of the advice that I gave, but community, sort of staying connected to others. I think it's really powerful and really helpful. And sort of, I know some people can feel anxious instead of like in terms of sort of like building that, maybe for different reasons. But I think, yeah, getting into contact, different communities, trying out different group activities, etc., that can be really helpful. And again, it can feel kind of like anxiety provoking for some people when they first hear of like making those connections and being in group spaces. But I do think there's so much power in community and staying connected to others, and finding those safe spaces to maybe share. Because I guess at different points you might feel safe to share with different groups of people. So I'd say, yeah, mainly just staying connected to others. I think as humans we're actually wired for that connection, and that connection can bring a lot of safety, a lot of love, a lot of hope. And yeah, so that would be my main sort of like keep well tip, is to stay connected with others, reach out to your local communities, community centers, and just stay connected.
Yeah, I think for me, again, there's a lot of the tips we gave for staying well with psychosis are probably tips that would apply to staying well generally, I suppose. Even though there may obviously be some slight differences in the experiences. I think for me, having kind of setting time aside to do things for yourself and look after your well-being. I think life can be really, really busy, and we can have lots of demands from lots of other sources, other people, and just spending some time. I know for me, what really helps is taking walks outside and nature. I think living in London, having so many people being on the tube, kind of the pollution, it really helps me to feel in more of a quiet space, maybe with trees. That really helps me. For me, things like reading fiction, that's really helpful as well to disconnect a bit from other normal life, everyday things, everyday worries, and have somewhere just to relax and focus on something else. I think those are really helpful as well. So connecting to your hobbies and to the outdoors, I'd say.
Wow. Well, going on from what you've said about having hobbies, would what's your favorite book that you've read, Adil?
Yeah, I guess I've thought of lots of things. I think the one I settled on, it's not necessarily the ones that I had or that I was thinking of aren't necessarily all uplifting fully reads. The one I settled on was Man's Search for Meaning by Viktor E. Frankl. So it's a book written by a psychiatrist who was imprisoned in one of the concentration camps during the Holocaust. And I guess the reason why I'm bringing up this book is he talks a lot about finding meaning, and finding ways, I suppose, to survive mentally and keep hold to kind of stay connected to yourself in awful, dehumanizing situations. And I suppose he mentioned that what he found made a difference was staying connected to your passions and staying connected to hope for the future, or things that you might be able to look forward to or do afterwards, and reasons why staying alive is important for you. So for example, for him, he'd written a book and he wasn't able to publish it before going into the camps. And so he was really keen on leaving the camp so he could share that book and hopefully help others with his research. So I think that's a really powerful message, to stay connected to your passions and to others, even when you're facing adversity.
Okay. Sounds like a good book.
I haven't read that. I'm gonna have a read of that now, I do. Look into that. Mine's also quite heavy, to be fair. I don't know if you guys have heard A Thousand Splendid Suns. But it's by an author called Khalid Hosseini, and again, I was like trying to decide, okay, what book, like, which book should I share? But I guess it's a classic because I've read it actually a few times. And it's basically has a profound narrative, and it sort of offers insight into the lives of two Afghan women called Mariam and Layla, and it's sort of against the backdrop of the sort of political turmoil that's been happening in Afghanistan over the past few decades. And it sort of delves deeply into sort of the traumatic experiences of the characters. So you have Mariam and Layla, who both endured sort of physical, emotional abuse, loss, and war. And the reason why I'm like bringing it up, and the reason why it's quite profound, is because it offers sort of a trauma-informed perspective that it sort of acknowledges these really prevalent real hardships and experiences, but also highlights the way in which the characters have sort of coped and survived. And I think it allows you to foster a lot of empathy and understanding as a reader. It's a fiction book, but you gain insight into sort of like the individual's internal world, sort of their motivations, their fears, their strengths. It really humanizes their experience. And it sort of show that despite sort of this really like intense trauma, emphasize in the book sort of the importance of relationships and social support when you're healing, sort of going back to the importance of community and like safe spaces, because you see a bond sort of develop between Mariam and Layla, and that becomes a source of strength and solace for both of the women. And I guess just thinking about, trauma-informed care, it really does stress the healing power of like relationships and community support. So I think in the novel, it sort of shows how connection is like a vital component of sort of like resilience. So yeah, essentially, I think it's a book that sort of conveys a message of hope, but it does not shy away from like depicting the harsh realities that people might experience, the harsh traumas that people might experience. But it shows also the moments of like joy, love, triumph, and sort of gives that like both sides of the portrayal of what it's like to experience sort of significant difficulties and sort of different ways to cope, and sort of how like love can foster amongst that. So yeah, that was my summary for my favorite book.
Well, sounds interesting. Um, do you perhaps have any questions for us, Rubia or Odile? As we're starting to like wrap up the questions now.
Well, I was actually going to ask what your guys' favorite book is as well, as a start. If you do have one, that would be really interesting to know, because I'm really interested in Odile's as well. So I'd love to hear what yours is, if either of you have one.
Jamil?
When I was younger, I liked the Harry Potter series. I like Bernard Cornwell. He does the Last Kingdom and series. And I also like the Lee Child with Jack Reacher series. So and I read quite a lot as well. I read like two books at the same time, and like daytime reading, and then like nighttime reading. So different books for daytime reading and nighttime reading. But But yeah, I'm also reading a library book at the moment, like a Charles Dickens novel. So it's called Our Mutual Friend, and it's yeah, like a relationship in during Charles Dickens times. So yeah,
Wow, that's a huge range.
yeah,
It's a good tip, actually. I never thought about dividing time, like nighttime and like daytime. That might actually help me get through my books. So that's a good tip.
yeah.
Thanks.
I tend to read daytime books like history or um like classic novels during the daytime, and then at night time do a different book. So yeah.
A genre as well. I'm going to keep that in mind for me to going forward.
It's basically how much your brain can take at night time and uh, do daytime as well. So yeah,
Oh,
yeah.
nice.
Yeah, definitely have less intense books that I read in the evening as well. Yeah.
Dylan, have you got any favorite books?
Um, no, actually, I remember a book by Stephen Hawking, which I really enjoyed. I think it was about his difficulties. It was like an autobiography or something. Um, I really enjoyed that, but I need to start reading more. I've got a book about gratitude. It's like a journal, and it just gives you some ideas of what to write. So it's just like it's kind of a journal slash book, like a guidance book. So
Nice.
I'm reading that, but and trying to be mindful. Um, I'm also quite mindful of the time, and I think we only have a bit of time left until the meeting will probably end because this is over Zoom. Um, so if there's any other questions, maybe we could ask them another time, or yeah, how do we all feel? Is that
Sounds
fine?
Yeah, sounds good. I mean, thank you so much for having us. It's been an honor. Yeah, thank you so much for the conversation.
Yeah.
Thank you.
Well, thank you so much for joining us um, on this journey into the world of psychology. We hope you found these insights valuable and inspiring. And yeah, keep exploring and stay curious. Thank you for watching Mo Talks.
Thank you to the
Thank
guests.
you.
Yeah, thank you to the guests.
Thank you for having us.
Yeah, thank you so much.